Hello, I'm Kim Miller with Inspired Hygiene, and I'm sitting here today with Amy Doneen, who's the owner of the Heart Attack and Stroke Prevention Center in Spokane, Washington. She is an expert in this field, and I'm actually going to let her give you her bio.
Oh, thanks, Kim. Thanks for having me. So I'm Amy Doneen. I'm a family nurse practitioner in Spokane, Washington. I own and operate the Heart Attack and Stroke Prevention Center. I have been lecturing on heart attack and stroke prevention for the last 13 years. And about 5 years ago, we started to learn more and more about the oral systemic connection, thanks to you and your expertise and your colleagues for teaching us. And we realized that from a cardiovascular standpoint, we in medicine need the assistance and the coaching from the hygienist standpoint to understand the oral systemic connection. So in the world of cardiovascular disease prevention, the oral systemic connection is really a big piece of the puzzle.
So Amy's being very modest. She's actually known worldwide. She has spoken all over the world. Tell me a little bit more about your level of expertise.
Well, so it started several years ago, and our focus really was on atherosclerosis identification, so finding plaque in the arterial system without an individual having symptoms. So what we've done over the last 10 years is demonstrate a new method, if you will, on how to identify disease in an asymptomatic patient, find out why someone has disease, monitor the effectiveness of treatment through an inflammatory disease paradigm. So, and it's been an exciting journey, and we've continued to learn.
And Amy is a pioneer also in helping women control their heart disease. As we now know, heart disease is the #1 killer of women. So Amy's been really on the forefront. And so I personally appreciate that. And I bet you can see in the film that she's wearing the red dress pin today, which I think is great. So I asked Amy if she'd sit down with me just for a minute and, in kind of a nutshell, explain to our listeners who are dental professionals why it is so important for us to treat bleeding gums regardless of depth of pocket in relationship to cardiovascular disease, stroke, heart attack, and diabetes.
Oh, great. Great question. So what we've learned, and a lot of the data has come across in crossover journals. So in a lot of the journals that we look at, the cardiovascular journals, we're learning that it's the periodontal pathogens that really delve and dive into the systemic arterial system and create inflammation. There's 2 layers of the artery wall. There's a protective layer we call the tennis court, which is otherwise known as the endothelium. And that endothelium is dynamic both in size and structure. It protects the plaque from actually rupturing through the artery wall. And what we've learned is that these pathogens that can hide in our gum line can get into the systemic system and change the environment of that very protective layer and allow an influx of inflammation through that endothelium and actually create activity within the area where plaque lives. So what we've learned is you can have pristine looking gums. Matter of fact, you can even go in for a dental checkup, unfortunately, and get a passing grade and yet still have this dangerous bacteria. So for me and my patients, I always recommend getting evaluated for the presence of dangerous periapical asymptomatic abscesses and also for the presence of oral bacteria, because I understand numbers. I don't understand the mouth. And so I want to understand, do you have any of these bacteria that could create problems in my world, which is the medical side? So that's kind of how I look at it. And what I've learned is that you can't tell just by looking at someone's gum line always if there's a problem. And what I've also learned is by the time there are bleeding gums, even one, there's a huge problem, potentially,
yes.
Right? And it's not normal ever to have bleeding gums.
That's right.
Ever, ever, ever. So that's something we've learned from the medical side as well. So
yes. Thank you so much for that. So the message clearly is, if the patient's gums are bleeding, we need to treat it.
Right, and if the patient's gums are bleeding, they have risk for heart attack and stroke. And also, type 2 diabetes can be exacerbated due to that inflammation. So what people in the dentistry world need to understand is that they have a direct role in the prevention of heart attacks, strokes, and diabetes. So it's not just making the smile look pretty, which is important, but it's a life-saving job that you're doing every day. So it goes well beyond just keeping the teeth and gum line healthy. It's about preventing really dangerous disease states such as heart attack, stroke, and diabetes. And by the way, heart attacks and strokes remain the leading cause of death and disability in this country. And women oftentimes die of their first event without even knowing that they had cardiovascular disease. 10 times more women die of a heart attack than cancers combined. It's not okay. We need to make a change here. So thank you for the work that you've done. It's really been helpful to us. We've learned so much from you and your colleagues. So thank you for that.
You're welcome, and thank you.